Dr. Shanna Dewsnup. I'm a clinical audiologist and co-founder of Happy Ears Hearing Center. I received my bachelor's degree in communication sciences and disorders from Utah State University with an emphasis in deaf education, and I received my doctorate degree in audiology from the University of Cincinnati in Cincinnati, Ohio. Prior to my oldest son's birth, I had never even heard of an audiologist. After he was born, he was diagnosed with a severe hearing loss, and we were told that he would need to wear hearing devices. That was something that I'd never even thought of. It never crossed my mind as a new parent, and it was definitely very devastating. Going through all the stages of grief and getting past the initial hearing loss diagnosis is what drove me into the field of audiology. I felt like, having been through it myself, I could be a better advocate for parents as they're beginning that same journey. Being an audiologist and being the one to work with parents through their child's hearing loss journey has been rewarding. It's been fun to see parents who are, very devastated in the beginning and how that quickly changes and they start to realize that their child is very capable. When someone comes into our clinic, the first thing that we want them to see is a welcoming face. We know that taking that first step toward treatment is always very scary, not knowing the outcome, not knowing what to expect. And so our goal at Happy Ears is for every patient to feel welcome and to feel that happy, positive vibe when they come in. Everybody in our office is passionate about what they do. They're passionate about the patients that they see, and I think it really shows in our patient reviews and just the overall dynamics in the office when someone's just sitting in the lobby. One of the things that I absolutely love about Happy Ears is the way that patients feel and their responses, even the first time they come in the office or at their follow-up visit. So it's so fun for me to see that as people leave and they come back, that they'll, like walking out the door, that the very first time that they get their hearing aids, they'll say, now my ears are happy, or they'll come back in for their follow-ups and they're just so excited about all the new sounds that they're hearing. Some of the sounds maybe they don't want to hear. It's funny, I've heard people say they hear sounds like house sounds, bathroom sounds, and things that they just were like, I don't want to hear that. Being at Happy Ears, it's just an amazing place to be. We have the best of the best audiologists. I know that's something that when we look for providers to join our clinic, we don't look for people that do the bare minimum. We look for providers that have empathy, that love what they do, that love helping people. And it's the same with all of our staff. Our entire team, from the front office to our scheduler to literally anybody that you work with in the office. It's such a joy to work around positive people on a daily basis. One of my favorite memories from an experience with a patient in our office was when he and his wife came in. He had these over-the-counter amplifier type hearing devices that were just whistling in his ears. That was all that you could hear, was this whistle. And his wife said, "These things are driving me crazy. He can't hear me." And I, after getting to know them a little bit better, found out that he's had this significant hearing loss for many years, and that they'd tried going to different places, but nothing had ever really helped. And so he'd resulted to these over-the-counter devices that were just, big and on his ears. And so we did a hearing test for him in the office, and I put some of our office devices in his ears, and he was just immediately amazed at how well he could hear. He could actually hear his wife. And I asked him, what's one of the sounds that you miss hearing? And he said, music. Music is the one thing that he just wished he could hear. And he hadn't been able to hear, the piano or all of these other types of instruments because his hearing loss was so bad. And so we connected his demo devices to my phone, and I streamed piano music through the hearing aids to his ears, and he just started crying. And it's funny because now when he comes in, he's actually since then gotten cochlear implants, and he's doing amazing with his cochlear implant. And his wife, every time they come in, she says, I remember when you made him cry. And it's just a fun experience to think of. And the other part of that too is that his mother lived in Mexico, and he hadn't been able to talk to her in 15 years, and because his hearing loss was so bad. And so that was the one thing that he was really excited about, was calling his mom and being able to talk to her for the first time, because she was getting, she was pretty elderly, and he was concerned that he wasn't going to be able to have that conversation with her before she passed. And so he was just so excited to be able to give her a call and have it go through Bluetooth to his hearing aids, and to be able to actually have that conversation with his mom again. And anytime they come into the office, it's just, it's so fun to hear how well he's doing now and how connected he is with everybody around him again, versus how he was when I first met him. Every office is different, every job is different that you have, but when you truly have a team of people that are very passionate about what they do, that are positive people, and that just build each other up, that's the best place to be.